Clinical Sciences Centre is a research centre based here at the Hammersmith Hospital of Imperial College London. It was set up initially by the Medical Research Council with the aim of providing a focus of basic science research within a clinical environment. The original thinking of the Medical Research Council was that they would create an environment where people are undertaking very high quality basic science, underpinning the understanding of human disease. And secondly, that we're able to translate this understanding quickly into improved diagnosis and treatment of patients. PET is used in several areas now. Cancer is really the leading area now where the technology is used, but it's also used in brain disorders and also in heart disease and certain forms of heart disease. If you take cancer, for instance, it's really used widely to look at recurrence of disease. And certainly you can extrapolate that to heart disease or neuroscience, neurodegenerative disease, where, for instance, in Parkinson's disease, there may be an increase or a decrease in the uptake of these radiotracers within a particular lesion. And that is used to identify that lesion. So it's really a technology that is really taking off in understanding disease, but also in diagnosing and treatment of treatment planning of disease. The technology can distinguish between a mass that is benign or malignant. It can also tell us how much, to what extent the cancer is spread in the body. It can inform us about whether a patient is responding to treatment or not. And certainly whether the cancer has recurred following treatment. So these are all aspects that are researched on this site. If you take, for instance, its use in diagnosing disease, one would be able to use the PET technology to tell whether the cancer whether it's a cancer or not, whether it's benign or malignant, and whether it's just a solitary nodule or a spread. So if it's a solitary nodule, then the patient could have surgery. If the cancer is spread, then of course that can inform on a new treatment plan that may involve chemotherapy for that particular patient. In terms of early detection, one of the areas we are focusing on is how tumors grow, and so the signals that are involved in growth. If we're able to detect those signals are going to change much quicker than the size of the tumor. So here we're able to really make an impact in being able to detect response to treatment much earlier than conventional anatomical imaging. Various PET methods are used to aid the current technologies that are available. So PET may not be the only method that's used, but it's used in conjunction with other methods for staging of cancer. The area where PET is particularly powerful in the context of staging is in lymphoma. In terms of checking for recurrences, this is one area where PET is considered to be very effective. Again, if a patient is PET negative, then the presumption is that they don't have a tumor. And if they're PET positive, then there's recurrence and something needs to be done quickly about that. Assessing the effectiveness of chemotherapy is linked somewhat to early detection. PET can allow the assessment of response to treatment to standard chemotherapy and of course some of the newer biological therapies as well. And here in a number of disease settings, for instance in non-Hodgkin's lymphoma, there is there's very strong evidence between the PET positivity or negativity and survival outcome. In terms of non-Hodgkin's lymphoma, for instance, there's a strong correlation between PET positivity or negativity and survival. And so the sort of research that we're doing has given us more evidence to support the use of the technology in determining response to chemotherapy. The old generation of PET scanners were just PET alone, and the new generation of scanners that we have a PET component and a CT component. So it allows us to combine both the biochemical output as well as the anatomical output. So you can see that the tumor is actually in the lung and not in the liver, for instance. And so that is giving us more information, which is changing patient outcome. PET imaging allows us to gain a three-dimensional understanding of the functional processes in the body. And so here we can see biochemistry in patients, in organs within patients, such as the lung, the liver, and of course disease areas such as tumors. And that is certainly changing the way that we look at disease. I think overall this is a technology that I feel is still at its infancy in sort of the sort of discoveries that we have to make, but nonetheless it's making a huge impact on healthcare and will continue to make a huge impact on healthcare in the coming years.